The ultrasonographic evaluation of the male reproductive tract includes assessing the prostate and the testicles in intact male dogs. These illustrations of a sagittal and dorsal views of the caudal abdomen outline the location and shape of the prostate. The bladder is a useful anatomical landmark to easily identify the prostate. By following the bladder neck region, we enter the urethra and more specifically the prostatic urethra, which divides the prostate into two equal-sized lobes. This is a normal prostate of a 6-year-old intact Boston Terrier presented for food bloat. On the sagittal view of the prostate, we observe that the organ is ovoid shape of homogeneous echogenicity and is located right ventral to the colon. The colon is associated with strong shadowing, likely the result of the presence of feces in its lumen. We can also see part of the bladder neck region going into the urethra. On the transverse image, the prostate appears bilobe. The lobes are symmetrical and homogeneous, except for the central portion, which represent the prostatic urethra and the urethralis muscle. They will appear hypoechoic to the rest of the prostate. We also see now the colon, which is located dorsal to the prostate. A normal prostate in a castrated dog, as seen in this 5-year-old Dalmatian dog that was neutered at the age of 2, is going to appear smaller and flatter than in intact dog. We see here a more flat ovoid shaped structure, but it still should remain homogeneous, as we see in these two views, the sagittal and the transverse views. Can again note the presence of the adjacent colon. Now let's review the video clip of a 8-month-old intact German Shepherd dog. The dog is in dorsal recumbency and a linear probe is placed on the caudal abdomen, initially oriented to provide the transverse view of the bladder and the prostate. We see two well-defined lobes, symmetrical with a hypoechoic central zone that was representing the urethra. On sagittal plane, bladder neck region, urethra crossing the two lobes. Colon is seen in the far field, just dorsal to the prostate. In intact males, the testicles can easily be evaluated. A high-resolution linear probe is usually recommended to best image them. On sagittal view, the testicle will appear as a ovoid, well-demarcated structure of medium echogenicity and fine echotexture. The mediastinum testis is seen as a central linear hyperechoic band. In this plane, we actually do not see the epididymis. Now on transverse images, and often when we use the linear probe, we actually can see both testicles on the same image. We can then compare these two rounded structures of similar echogenicity and echotexture, and only a discrete small hyperechoic focus will be seen centrally located and represent the mediastinum testis. We also see on this side the epididymis. This video clip will demonstrate the placement of the probe on each testicle of this 6-year-old intact Boston Terrier, and initially the probe is positioned along the long axis of the testicles. And starting by the left one, we see that it appears ovoid, homogeneous in ecotexture. We see clearly the mediastinum testis centrally located, and as we move the probe along the spermatic cord containing the vas deferens and the pampiniform plexus, we can see how vascular that pampiniform plexus is. Now, moving back the probe caudally, we will shift to the right testicle that show similar echogenicity. The mediastinum testis again very well visualized, and part of the epididymis is seen caudally. Moving the probe 90 degrees, we will now image both testicles and be able to compare their size, shape, and echogenicity. Again, the mediastinum testis will appear as this centrally located hyperechoic focus. Part of the epididymis is also seen on this outer side and along this testicle.